Hello, it's Dr. Rhonda Johnson. Today is Wednesday, September 28th, 2022, and today I'm going to be discussing the new CDC recommendations, the updated ones for COVID infection control in healthcare facilities. But first, my heartfelt thoughts and prayers to all the folks in the path of Hurricane Ian. Please be safe out there. Now, the CDC changed its recommendations on September 23rd on their website. They said that they changed to reflect the high levels of immunity, both vaccine immunity and infection-induced immunity, and the availability of effective treatments and prevention tools here in the United States. Their new guidance applies to all U.S. settings where healthcare is delivered, including nursing homes and home health, and I'll include the link for your reference. Now, I can't cover everything, but here are a few highlights. That healthcare facilities should have an abundance of communications that make sure everybody entering their facilities are aware of recommended actions to prevent transmission of COVID. So there should be signage and communications that encourages everyone to stay up to date with all their COVID vaccines and boosters. And then people should be asked these three questions. Do you have a positive viral test for SARS-CoV-2, symptoms of COVID-19, or have you been in close contact with someone with SARS-CoV-2 infection if you're a patient or a visitor? So that's kind of like the honor system. And many healthcare facilities do this now. Now, here's the big area that's getting a lot of attention. The CDC is dropping their recommendations for mandatory masking. I'll just call it universal masking everywhere and at all times in healthcare facilities. The CDC says if you are in a community that does not have high transmission, that facility can choose not to require all doctors, patients, and visitors to mask. So basically leaving it up to the local facility based upon your community transmission levels. Now, the CDC also says people can choose to use masks, they call it source control, based upon their personal preference, informed by their perceived level of risk for infection based upon your recent activities and your potential of developing severe illness. So it's up to the person to decide, unless the institution decides for them. Now, the CDC also notes that visitors with confirmed COVID infection or compatible symptoms should not visit in person for 10 days to a healthcare facility. So please, folks, if you think you have COVID or you know you have COVID, don't visit the hospital, nursing home, etc. And if you have healthcare appointments, reschedule them. And CDC says wait until 10 days. Now, there are a lot more specific recommendations for dental offices, nursing homes, for healthcare facilities, EMS, dialysis centers. They talk about COVID testing of asymptomatic folks, infection control practices for patients, and much more. So if you're really concerned about this topic, I encourage you to look at the CDC website for more information. Stay tuned. Let's see how this goes.